We begin this Wednesday with breaking news on the coronavirus outbreak. Good evening and thanks for joining us tonight. I'm Dennis House. A third case has now been confirmed here in Connecticut, and it is a mystery as to how this person became infected. That patient is an elderly man from New Canaan. We're told he had no known contact with anyone who has the virus. Here's a look at the big picture for you tonight. Globally, there have been now more than 118,000 cases in 114 countries. More than 4,200 people have died from it. The World Health Organization officially declared the virus a pandemic because it's now spread to more than 100 locations around the planet. We have team coverage for you tonight. Channel 3's Matt McFarland and Joe Zone are standing by, but let's begin with Susan Raff. She's live at the Emergency Operations Center inside the O'Neill State Armory. Susan?
Will simply no longer be able to take a deep
Dennis, Governor Lamont made a point of addressing people yesterday, and in fact, we're told they're going to have daily briefings because they are concerned about the coronavirus, and the governor is focusing on testing and protecting people. As you mentioned, a third case of the coronavirus has now been detected in Connecticut, and with states like Massachusetts, New York, Rhode Island, all neighboring states having more cases, some say it is just a matter of time before we see more. But they are also cautioning people not to rush to the hospital. If you have a cough or flu-like symptoms, they are saying that you could assume you actually have the coronavirus, and instead of rushing to the hospital, you should contact your doctor and see if you can get advice on how to take care of yourself at home.
What we're going through is incredibly difficult. We have not seen a pandemic like this in 100 years. And none of us who are in this room today have ever been through anything quite like this, with a new virus that none of us have ever been exposed to before, crossing the world, and now in the United States, and now in Connecticut.
State health officials say the last thing that Connecticut needs to do, or any state for that matter, is to inundate hospitals. They want to keep people at home if they can. And in fact, hospitals are also stepping up their efforts by having trailers outside. 10 hospitals are doing that so that they can screen patients there. Connecticut lawmakers met for the first time today ever since Governor Lamont announced yesterday declaring a state of emergency. They are going over the governor's actions to make sure that we are doing the right thing. And in fact, all of the lawmakers, Republicans and Democrats, feel the governor is doing the right thing, that we can't be too concerned, and the goal is to be as vigilant as we possibly can. As you've seen, schools, colleges are all closing now because of cleaning, and in fact, the state capitol will be closed tomorrow and Friday so they can clean those buildings as well. The good news perhaps for Connecticut is that we are getting some help from the federal government, some $7 million, and they are hoping to get 500,000 plus face masks next week. We are live at the State Armory in Hartford. Susan Raff, Channel 3 Eyewitness News.